So I want to talk about a number of different issues related to women's health. I'm going to talk about Polycystic Ovary Syndrome, and I'm going to talk about preparing for pregnancy. I'm going to talk about gestational diabetes. I'm going to talk about I'm not going to talk much about the blood sugar issues. Amy already did a wonderful job with that. Cardiovascular disease in women, this is particularly important because women aren't doing well with both the diagnosis and treatment of cardiovascular disease. And I'm also going to talk a little bit about cancer and the conditions that are associated with cancers. But as I'm going through this, I want you to keep thinking it's not about the treatment, although we know low-carb keto can be very effective in treating a number of these conditions. But we are not doing very well in this country with prevention. We wait for too many people to get really sick. And then it affects their quality of life. It affects the quality of life of their family. It could affect their ability financially to support their families. The cost of health care are increasing both to companies. It's increasing for families. And we really have to do a lot better. So I'm going to spend a lot more time, but I want you to think about prevention. Now, some of these conditions like PCOS and pregnancy may not apply now to all of you here, but it certainly could apply to your daughters, could apply to your nieces, could apply to friends you may have. So that's something to keep in mind, is what more can we all do to help other people prevent perhaps winding up in the position you were in when you found low carb. So insulin resistance and hyperinsulinemia, as Amy talked about, is really what's important, because there is a common denominator to a lot of these conditions, and that's hyperinsulinemia that occurs after you consume large amounts of carbs, which is the typical Western diet. So there are stages of hormone changes, and part of that is what I'm going to be presenting today. But when women have significant hormone changes, what goes along with that is they also develop more difficulty regulating blood sugar and levels of insulin. It's very common when a young girl starts to go through puberty, boys gain lean mass, girls gain fat. And some of us gain too much fat. And that can begin our weight loss journey, or our struggles with weight loss. Pregnancy, of course, is a significant change in hormones, and that's where many women also begin to run into difficulty. Perimenopause. How many women here with perimenopause, if you choose to raise your hand, found out that you really started having difficulty with your weight? I know I certainly did. It was an eye-opener for me and Dr. Atkins when I started to go through hormone changes. Because the diet that I'd been on, which was low carb, had to get stricter and stricter and stricter. I couldn't make ketones anymore. I started gaining weight. I was on 20-gram low carb program, and I was still gaining weight. And it took quite a long time for all that to straighten out, and then for my weight loss to begin to normalize again. Menopause, of course, is another issue where many women will spend a lot of years of their lives in menopause. And this is a time where we also want to invest in our future health by controlling your blood sugar, controlling insulin, controlling your weight, and improving your quality of life as you age. So I'm going to talk about Polycystic Ovary Syndrome. The insulin resistance is related to Polycystic Ovary Syndrome. And it can occur in overweight and obesity, which is often associated with PCOS. But it also can occur in lean women, as Amy had talked about. And so it's important that we recognize it, because 5 to 10% of our female population have PCOS. The numbers are probably higher. Part of the difficulty with Polycystic Ovary Syndrome is that it often goes unrecognized. It can take several years for a younger woman or a young girl, because it can start around the time girls start getting their periods, before it's even recognized that they have a problem, and before there's appropriate treatment. So diagnosis can be delayed several years, and they may have to see several doctors before the doctor looks at the cluster of symptoms. There's high testosterone, which is related to the high insulinemia that the young girl has. There's cysts on the ovaries, and there's menstrual disturbances, can be to the point where a girl doesn't even get her period, or may just get very few. And infertility is that's a major cause of infertility in women in the United States, is polycystic ovary syndrome. And it often isn't recognized until a woman goes to a fertility specialist to say, my husband and I are trying to get pregnant, we have for a year, and we can't. And that's when the diagnosis is often made. And then unfortunately what happens is there's a lot of fertility drugs given, a lot of hormonal manipulation, which in the longer run can cause more metabolic issues for that young woman as she goes through the rest of her life. I want to mention about the side effects of testosterone. So some of the symptoms that a young woman will find is abnormal hair growth, including in different parts of their body, but you can imagine how disturbing it is when there's a lot of facial hair growth. And I remember when I was younger with working with Dr. Atkins in the 80s, and we had women come to us who had PCOS but came to lose weight. And I had some patients who had to shave their faces every day. So you can imagine what that's like for a woman in order to have to do that. And not only are they upset that they're obese and they're struggling, but also to have that happen. And they may be losing their hair. Male pattern baldness can also start to happen. Acne is a common side effect. Some women actually will get a deeper voice because of the testosterone effect. Women have testosterone and need some level of testosterone, but you need to have more of the female hormones, not the male hormone. In men, it's the other way around. Men, as they get heavier, can also start getting more estrogen, and that can suppress their testosterone. And that's not something you want to have happen either. So polycystic ovary, if you succeed in getting pregnant, and you can with low carb, but if you succeed in getting pregnant, you have an additional complication that can occur with your pregnancy, and that's preeclampsia, and I'll talk about that later. You also have, and this is really important, you have a higher lifetime risk of type 2 diabetes and cardiovascular disease if you have PCOS. And that goes along with the hyperinsulinemia. And yet that doesn't really get addressed. And that's where we want to talk about prevention. Now, you may have a family member who has PCOS, and you may kind of talk them into, well, try a low-carb diet, especially if you're having trouble losing. But I will caution you, babies can happen. We've seen it happen clinically, that someone is struggling to get pregnant, and they do. So if it's someone who does not want to make babies, they need to know that they need to use a non-hormonal method of birth control so that they don't get any unexpected surprises. So this was a study where they compared a low-fat diet to a group of women with PCOS, and they used a diet of 41% was still carbohydrate on the diet. And they still got good results, but in clinical practice, we would use a 20-gram total because you want to get, first of all, excellent compliance because your appetite will be a whole lot less on 20 grams than on 40. But you want to improve their metabolic imbalances as quickly as you can so they start making more progress. And the more progress they have with the start losing weight, they're more likely to comply. So, but they still got good results with the 41% diet. What they found was all of the metabolic parameters got better. But if you do a 20-gram diet, they will get a whole lot better, a whole lot faster. One of the authors of this study said that it was, basically safe and effective, and there isn't any reason why you shouldn't recommend carbohydrate restriction. So it's beginning to filter down somewhere. I've waited a long time to see it filter down as much as it has, but I do think we've reached a tipping point where I think that we're probably just going to continue to make progress, and it's educating people, and you're sharing your experience. One of the things Dr. Atkins and I talked about a long time ago, a couple years before he died, was that this needs to be a grassroots movement. The powers that be in our nutrition guidelines and all of that aren't likely to change. Although the American Diabetes Association has begun to be a little more enlightened, and we should acknowledge them for that. But there's too much money and politics and power in all of this. So we are the ones that have to make the change. So share your experience. Of course, lipid parameters get better too, which we all know that. Your triglyceride HDL ratio gets a whole lot better, and a lot of people, LDL gets a whole lot better too. And babies can happen. So, polycystic ovary and cardiovascular disease risk in women with PCOS. Again, as I mentioned, they usually just go to get help with infertility, and then after that, no one discusses their risk for type 2 diabetes or cardiovascular disease. This is where we have to support people to understand that. And this was a study that was done where they took young women of reproductive age and they looked at their cardiovascular risks. And 33% of them already had coronary calcification. So these could be women in their 20s and 30s. So what's going to happen to them by the time they get to their 40s or 50s? They had hypertension, which would stand to reason they do. Many of them had diabetes. Some of it was undiagnosed. They had low HDL, high triglycerides. A lot of them smoked and had a family history of cardiovascular disease. But there's an issue where women don't necessarily see cardiovascular disease as a woman's disease. You hear about men having heart attacks, or that before menopause women don't get heart disease or heart attacks, and yes, they can. It is such an issue that there is an organization, and this is always a mouthful to try to say, androgen excess, androgens are the male hormones, Androgen Excess and Polycystic Ovary Syndrome Society. They are beginning to try to get people to understand, and practitioners to understand, that you really have to work harder to identify these women at risk for future health conditions. So if you have impaired glucose tolerance, which means after eating carbs, your blood sugar goes too high. And of course, on the standard Western diet, that's very common in the United States. And they should have a glucose tolerance test every 2 to 5 years. And that would be a 2-hour glucose tolerance test. At the Atkins Center, we did 5 hours. We also measured insulin levels. So in the process of doing that, we learned a whole lot about how significantly insulin levels after eating a high-carb diet can go. And significant damage can be done to the body when that happens. And given how often people eat in this country when you're on a Western diet, because you're hungry, because you crave, you can spend a lot of your 24 hours with very high circulating insulins, and that can make you sick. Checking fasting lipid panel is also important, should be done every 2 years or every year if you're already beginning to see high triglycerides and low HDL levels. And every visit, a doctor should discuss obesity and hypertension. Now, when you have a 6 or 7 minute visit with your doctor, there can be a lot of other things to discuss, unfortunately. But that's the state of what happens now with our insurance system. Protecting the next generation. So we talk about prevention. This is as far back as we need to start going, and it really doesn't happen. But this is something I've been interested in for 12, 13, 14 years. I've collected data on what happens when the fetal environment is unhealthy, and how does that affect that child for the rest of their life. And we're finding out that it can affect them significantly. That child, the fetus, is going to be affected by the health of both the mother and the father. It's not just mom. Once the mom is pregnant, it's going to matter because of what she eats and how much weight she gains or not. But the genetics that this child's going to get at conception is going to be very much affected by the health of both the mom and the dad.